Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. So, welcome back to the program. This week, I am with two Norway military members who have been doing missions in eastern parts of Europe and southern parts of Europe. I'm with Dr. Haakon and Bjørn. I've met Bjørn a few times over the last few years. Dr. Haakon, I'm delighted to meet you. Can you tell me a little bit about yourself and what you do?
Thank you for inviting us here. My name is Haakon Asak. I'm a medical doctor, consultant anesthesiologist for the Norwegian Armed Forces, and currently the medical director of the Norwegian Evac, doing the ongoing operation with the transporting of Ukrainian soldiers to European countries. I'm pleased to be here.
Good. Bjørn, tell us a bit about yourself.
Yeah, my name is Bjørn Eidissen. I'm the chief sergeant for the Norwegian Aeromedical group. And we are flying on three platforms, 737 Boeing, Hercules, and Bell 412.
So last week when we were teaching here, we tried to do this podcast, but you guys got called away. So hopefully you guys don't get called away during this. We can finish it later, perhaps. But so tell me about your platforms. Tell me about what your capabilities are here, and why is the Norwegian military doing this in Ukraine?
Yeah, the platform we have is the platform we are doing the medevac from Poland with the Ukraine's soldiers are a Boeing 737 civilian aircraft, who is built as a big air ambulance aircraft. Why Norway is doing this? It's because it's I think it's agreement to EU, the Norwegian Ministry of Health have done, and we're flying patients all over Europe every week for ERCC, actually, yeah.
And what's your medical training? A nurse, paramedic, doctor.
The medevac crew is doctors, special nurses, and paramedics.
So on each flight you have anesthetic doctors, and you have nurses, and you have paramedics on all of them.
Yeah. Every team, it's about 8 persons. It's a medical crew director, it's 2 doctors, it's intensive care nurses, anesthetic nurses, and paramedics on every mission.
And how many casualties can you have on your 737?
We can have 20 stretcher and 30 sitting patients, and 3 of the lie-down patients are ICU patients.
And have you filled it? Have you had all of those positions filled on a mission?
Almost. I think we have 18 stretcher and 25 sitting patients on
18 stretchers.
Yeah.
So you have that many casualties, and you have 8 medics, doctors, and nurses. That's a mass cash. That's a mass casualty.
That's a normal team. So every time we have more patient and 8-9 person can do, then we add more doctors and nurses to the plane.
So tell me about some of your recent missions on your platform.
So we are flying basically every week, 1 or 2 days. Most of the patients are either gunshot wound patients or blast injuries. Some of them have combined burn injuries, and we also fly some medical patients, mainly advanced cancer patients. Mm-hmm. So we experience that the Ukrainian healthcare system are doing a great job here. They are obviously overloaded and are treating the patients in the same standards that the rest of Europe does and US. So we are very admired about helping them out to take the particular patients out to further treatment in Europe. and basically that is to help the healthcare systems deal with the overload, not particularly the treatment, because they can perfectly do the treatment themselves.
And where are you taking? What countries are receiving these casualties?
So we're flying to Germany, which takes a huge amount of the patients. We fly to Belgium, France, Denmark, Hungary, Finland, Netherlands, and Croatia we've been to also. And usually we bring also patients back to Norway every week.
So there has been more missions than just Ukraine that you guys have responded to. What else have you guys responded to on your platform?
Yeah, recently we was in Turkey to do medevac for the patient after the big earthquake who was there. We was down there with a C-130, and we fly down in Turkey for 2 weeks, and we do altogether 8 missions down there. So we evacuation over 200 patients from the earthquake area and into the big cities central of Turkey.
So yeah, that's a lot of casualties, and you're bringing them back into different NATO countries as well, instead of straight into Norway.
No, we only fly the patients inside Turkey from the earthquake area and into the big city in Turkey.
Was
that a response or a request from NATO? Is that why that?
Yeah, different from the Ukrainian mission. This was a NATO mission, so we were. It's a joint mission together with Netherlands and Great Britain, which also had a Hercules C-130 medevac plane. So we were flying all together a few hundred patients and deliver them basically to Ankara and Istanbul, Western Turkey, picking them up quite close to the zone of the earthquake. Most of these patients were crush injury, dialytic patients, and a lot of amputees, of course. And quite commonly they have very severe sepsis too. So it was quite a challenging mission for us, and especially the experience from last year from the Ukraine operation. It was really helpful for us to be organized, and even though this was earthquake, some part of the operation will be quite similar too. So we were quite happy about the way we did it already.
And on these missions, are you exiting the plane and treating, or is it just a transport from the receiving facility?
No, we are arriving patients on the airports. A lot of ambulances coming, we do the triage, and then we start the treatments of these patients. Some of the patients are good treated from before, but some of the patients need emergency treatment right away. So it's a very important part of the job is to do the triage with the doctors quite early and do the priority for unloading, offloading, treatment on board, stuff like that.
How's the handover? So when you land on the border of Ukraine and Poland, what type of handover are you getting so you know what casualties you have?
In the Ukraine mission, we know what kind of patient we get from before, because the communication between Haakon as the lead doctor and the Ukraine government is quite close. So we know the most of the thing with the patients every time. But because of the long distance, some of the patients we get to the plane have been on the road for 12 hours. And with infection and stuff like that, we get some utfordring.
Challenge.
Yeah, we get some challenge almost every time.
Yeah, I've heard from some of our paramedic graduates who are working in Eastern Ukraine that it's a 10-hour train ride from Eastern Ukraine to Kyiv. And then from Kyiv, there's going to be another, 8 hours to Lviv? Or is there a flight maybe that goes from Kyiv to Lviv?
So So most transport in Ukraine is gone by ground transport, either by train or vehicles. So as Bjørn said, when we meet those patients at the airfield the day of mission, they have been transferred at least for some hours the same morning, but they have been on the road or on a train for a long time, because most of the injuries or the casualties will arrive basically from eastern Ukraine, and they're really long distances. So most patients are treated from the closest hospital where the point of injury, and they have been treating more advanced on the way usually. So we know at least that the hospitals in Lviv is very busy, and we expect most of the hospitals to be very busy. So we are happy to try to unload the huge amount of casualties for Ukraine.
So most of the casualties you're getting are somewhat stable.
Yes, I would say Ukrainian healthcare workers are doing a great job in picking the right patients. So the severe injured patients in an unstable situation are usually treated in an intensive care unit at a hospital in Ukraine. And as soon as they are improving and not in need of advanced organ support help, they will be treated. But some patients need oxygen or fluids or antibiotics or painkillers. But almost all patients are self-breathing and in a quite stable situation. But of course, some of them are deteriorating in a long transport, so we have to be very aware of it. So especially for thrombosis and sepsis, which is a huge threat for these patients.
And are you bringing medical equipment from the EU or Norway and dropping it off as you land, or are you just bringing casualties back?
We are bringing casualty back. That's the main mission. But we bring some equipment down because Norway, EU have donated a lot of ambulance buses to Ukraine. So all the equipment they need to the buses who is donated, we try to bring down to them. So almost every week we have some equipment with us down.
Good deal. So you're getting casualties over from Lviv into Poland. You put them on your Boeing 737, and then you fly to either the EU or Norway. What are some of the most difficult cases you've had to deal with whilst in flight?
We have quite various patients, but especially young soldiers being shot. We have different cases of neck fractures and tetraplegic patients. We have some burn injuries and some small children being collateral damage from the war. So most of these cases are quite severe, and just meeting those families traveling out of their home country with one or two small bags and see their hope in their eyes to try to have a better life in a different country, at least until the war is over. But we have to say that all, especially the soldiers and patients we meet, they really would like to go back to Ukraine as soon as possible. So they basically don't want to go, but they realize that this is the way to, for a while at least. So we have quite complex patients and also several amputees, of course, and severe injuries in internal organs or genitalia or face, and it's quite complex, I would say.
So for the past 20 years, there's been a different focus on the militaries in the U.S. and NATO. And what was your mission during the last 20 years and in the sandy places of conflict?
Yeah, for the Air Medevac group, it's have been different missions, but the biggest mission we have, it was 5 years of Medevac helicopter in Afghanistan. So we fly with the 2 Bell 412 ambulances down there. And then, of course, when you have soldiers all over the world, you have to pick up some of them sometimes with the normal air ambulance traffic.
And also we had a mission, the exit Afghanistan, exit Kabul, which was in 2021. We had a lot of aircrafts flying injuries and casualties and refugees out of Afghanistan to Norway. So that was also quite a busy mission.
Was that multiple trips? You're going back and forth?
Yeah, we had
trying to get
air
people
bridge
out
for almost a week, I think.
a full week.
12 days. We was flying every day and night for 12 days. First from Kabul to hvor var den? Yeah, we fly
Somewhere else in the Middle East?
yeah, somewhere Tbilisi.
Oh,
Yeah,
fair
of course it was. We fly from Kabul to Tbilisi and from Tbilisi to Oslo. Yeah.
So you had an air bridge from Afghanistan to Tbilisi, and you were pulling out your own State Department people as well, your own embassy, and getting all the Norwegians out as well as other NATO members?
Yeah, basically I think they were Norwegian, most of them, but I think we had some also collaboration with other countries too. And we know that some of the family members were actually spread in Europe, but I think most of them have been reunited afterwards. But it was quite a chaotic situation, so they had to evacuate as much as possible out of Kabul those days. So, I mean, most countries were helping out either way. So, but we flew only to Norway at that time, I think.
Yeah, we do that. And as many people have seen on television, all the babies who was throwing over the fence, Norway have a hospital in Kabul at the airport at that time. So many of the children was treated at the Norwegian hospital, and then we fly them back to Norway, and after a while they have been connected to the family.
Ah, it's fantastic.
So, yeah.
So looking back over the mission that you've had in the Middle East, what lessons learned did you have there that you brought into this new Ukraine conflict?
I think one of the biggest lessons we have learned is the civilian military cooperation. We all doctors and nurses and paramedics we have on our team, it's working on civilian hospitals, ambulances, stuff like that. They are with a contract with the military on the Aeromedical group. So when we need them, we call them, and they have to meet on very short notice on the airport. All the equipment are ready. They are trained. We are training every year, many weeks. But what we have learned, it's the nurses and doctor paramedics need to know their medicine. We can't learn them that because we are too small army to do that. So when they're coming in, they are medical trained. We train the military, and that combination is very, very good for us anyway. And I think that's the best learning we have done for the last few years is use the civilian expert to do military missions.
Is that a new option? Or did you used to have allocated doctors and nurses who only did military? Or you've always had a collaboration between the civilian and the military?
Yes, this has been ongoing for quite a long time. So we learned some years ago that the best way is to have professional clinicians doing their everyday job at the hospitals. They will be on our teams when we do the missions, and it actually works quite good. So the teams are rotating every week, which team will be for next week. So we are quite happy with that solution. And also we learned that you can expect a lot of supine patients in these scenarios, but all patients who are able to sit, they will actually prefer to sit. So it's actually also a balance to have enough seats. Even though they are quite severe injured, they really prefer to sit. So you have to balance your logistics to have enough stretchers, but not too many, and you have to balance that. That works fine. And also we learned that close relations with our partners is very, very important. So to have this successful operation ongoing, we need a daily closed loop communication with all kind of partners into Ukraine, even, or the partner countries in Europe. So you need to follow it very closely. It's a huge logistic operation, I would say.
It is a challenge to get all these 29 countries, 28 countries now that one person left, to come together with different languages and different equipment, and then you lot are coming in as non-EU and still be part of the team. So yeah, having that collaboration is important. Is that something that you have done in the past and always had some joint missions just to keep that sharp edge?
Yes, we are quite used to work with allied. We have done that in Afghanistan with several countries, with Germany and US, of course, and several other NATO countries. So I think it's important to be able to work very close together, because when the shit hits the fan, all of us needs to cooperate on across the border lines. So I think we are quite used to it, and most other countries are thinking in the same way. We are quite fortunate that we have the civilian medical aircraft available for these missions these days, and we are trying to improve our system and planning to change it for a newer aircraft. So we have plans about improving our system and also increase our capacity.
I'm happy to hear that you guys have a collaboration with the civilian healthcare system, because in the U.S. Army, when I was in, Army medics or SF medics never really touched patients that much, maybe allocated 1 week a year. And the beauty of your system is you have medics who all day, every day, they're practicing their medicine. And then when it hits the fan, as you say, they get pulled in and they are supporting you guys who are full time. I could see the benefit in other militaries that don't embrace that. And talking, so we're teaching the tropical medicine course these 2 weeks, and we're seeing a lot of your civilian medics and doctors coming through, nurses coming through, and I learned that they have 6 weeks a year that they have allocated for training, which stuns me. It's spectacular to have a 6 weeks option for these guys that they must donate or not donate, but they're coming in and working for their time. And one of those weeks is here now learning the tropical medicine, and it's interesting to see the system work that you guys have set up.
Yeah, and the 6 week of training is the 6 weeks of training. So all the mission, if we are mission every day, we can use them every day. So all the mission is not on that number of 6 weeks.
So the 6 weeks includes their mission time, not just training.
No, the 6 weeks is only training. So the mission is coming
separate
upon
from
that.
that.
Yeah. So right now the teams are flying mission about every 5th week, and then the training is added to that.
So both of you have a very influential job with this. What changes would you like? What improvements would you prefer to have for your mission?
It's a very good question. So far, we are very happy about the collaboration with the Allied and also the system in Norway, the military-civilian cooperation. So we are very happy about it. It's a very closed loop and very low-profile way of dealing with the problems or the challenges. Probably it would be possible to improve it with understanding of the whole system. This is a complex logistic and medical operation, and we feel trusted about doing it. But sometimes we also have questioning about what we're doing, which is good. But we would like to try to deal with it in the best way we do. And this is actually most important success factor, in my opinion, is the very close loop with the partners. And we have to trust each other in a very detailed way, because we are fighting for each and every patients, and in that case we have to work in a little bit less bureaucratic way. But we are all in all quite happy with the way we do it.
Yeah, I'm agree.
So Bjørn, what improvements would you like to see in your office as well as this mission?
If one wish I have, it's we could move more patients out of Ukraine, because we have capacity to do this mission several times every week. We do this mission 1 or 2 days every week, but the capacity on the airplane, on the team, is bigger. So if the Ukraine can move more patients out of Ukraine, we are happy to help them.
So the limiting factor is getting them from Kyiv to Lviv, and from Lviv, they're a bit busy at the moment. They have
something to do.
A monumental task on trying to get that in place.
But that said, we are really impressed about the way they do it. I mean, they are picking the right patient, I would say, and especially patients needing a lot of rehabilitation and long-term antibiotics and also reconstructive surgery. So they are the one in charge, obviously, to decide which patients are supposed to be medevaced. But we are ready to improve and also increase the capacity. So it's actually totally up to Ukraine what they need and want. We will reach out our arm and help them out if they need it.
I was impressed with the medical system that I saw in Ukraine. Even before the war, I was there helping them set up their paramedic system, and their felchers, who are now paramedics, and their nurses and their docs are top notch. It's really, I'm really impressed to see how they've stepped up to the bar and they've become world class. So a more difficult question is what's next for you? So in the next what do you see yourself in 5 years, or are you transitioning out into the great civilian, which is a tough transition, but what's the 5-year plan for both of you guys?
Okay, me first. Yeah, my 5 years plan is to retire and start working on Malta. No, I think the next few years is really important for us, because we are, as we speak, try to build a new plane, an Airbus 320 Neon. It will be a new ambulance. So we are in the finish of that process to start building the plane. So it's a lot of meeting, equipment, what kind of equipment, air improvement, all that stuff. So that's, I think, it's one of the biggest challenge right now, to get that plane ready as soon as possible, because this 737 is start to be quite old. And the next thing is to keep going to do the medevacs for Ukraine, how long as they need to do it.
For me, it's pretty much the same. I'm only turning 50 this year, so I have a few more years to go in the armed forces.
You're young.
Yeah, well, but I'm really motivated to keeping leaning forward, trying to improve the system and increase the collaborations. So as long as there is a need for me in the system, I will do my best. But there will be probably a day or two coming up when we will take some more rest. But it's very easy to motivate each other for such missions we are doing right now, both for Ukraine and also for Turkey earlier this year. So I think I feel really blessed being able to help out in such a case. So I look forward for every day working with the armed forces. So as long as it's like this, I'm not too worried about the future. It looks like we will have a lot to do for some more time, at least.
It looks like it. I guess my last question is going to be the most difficult, and you guys can pass if you want. But in the military, we have such a problem with training for our last conflict. In the U.S., when I was in the Green Berets, we trained. It was all the Soviet mission, even though the Soviet collapsed at that point. Of course, now we're back at that problem, but and we just kept fighting the 80s war in the 90s, and then finally 9/11 happened and the world kind of changed. But how do you see your position addressing this issue? How do you see Norway moving forward and preparing for the next conflict medically?
It's a very complicated and tricky question, I would say, but we have learned from all kind of missions. I think even today's mission is different from a few years ago, and we have to be able to think out of the box because the world is changing quite fast. So we will see injuries and way to do the wars in a different way. So we have to be flexible and try not to be too focused on today's mission, especially about our capabilities, and trying to be as flexible as possible, and even try to look into the future and see how we can solve mission in a probably a different way. But what you actually know we need professional workers, and we are trying to keep them busy and also that they are happy with what they're doing. So as long as you can keep your professionals, I think that's the most important, and try not to be too focused on today's mission and be able to solve complex missions with different injuries and different nations and different geographical challenges. So it's complex, but we are trying in our new aircraft, the planning of the new aircraft, we are trying to look into the scope of how big capacity we should be supposed to have. So we will probably increase our intensive care capacity, being able to move, let's say, more burn patients inside Europe, and there are a lot of possibilities. So yeah, but it's difficult.
Bjørn, what do you think?
To keep up the good work, I think it's we are quite lucky because we are a civilian military system with the medevac. So when there is no war going on, then we fly on earthquake or tsunamis or whatever. So we keep the doctors, nurses, paramedics busy and professional at all time. So, and for us to move patient is to move patients. So we fly to an airport, pick them up, fly them to another airport and deliver them. So I think we should keep going, keep doing what's working.
Well, I appreciate it. Do you guys have any final comments or final thoughts for this?
We both appreciate that you take the time that we are able to talk a little bit what we're doing, and we are really grateful for all the support we get, both from Norway, different ministries, and also our armed forces, and also that we are so lucky that we can try to make a change in a tricky world. Yeah, that's really, I'm really happy for it.
Yeah, I agree.
Dr. Haakon, Bjørn, thank you for taking the time, and I look forward to hearing from you guys in the future.
Thank you.
Thank you very much.
This has been a presentation from the College of Remote and Offshore Medicine Foundation. If you would like to earn CPD credit for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credits, free access to the virtual field guide, and discounts on our e-learning courses. You can join the team on the college website, which is Corum, C-O-R-O-M, corum.org.